Hi, it's Dr. Noel Williams, August 9th, 2021, COVID update. Tonight we're going to focus on adults and being unvaccinated and what's going on, because it's time for everyone to realize what's in store for us now because of the nature of the disease event. So today I had a patient who we'd seen on Friday who was very sick, unvaccinated, got sent to the ER. Ended up early Saturday morning. Oxygen saturation was 91%. Had terrible abdominal pain. They worked him up for a bowel obstruction. All of that was negative. It was just the COVID enterocolitis causing him pain, but he had bilateral COVID pneumonia. So he's very sick, very ill, doing poorly. His wife's an RN, and they said, and this is in a major hospital in Oklahoma City, and the ER doctor said, "We have no room for you. You don't make criteria. Go home." And they gave him 500 cc's of fluid, which I wish would have been 2 liters, and they sent him home. But I'm not criticizing the ER doctor. The ER doctor, the wife said, was not particularly nice. He was professional, but not particularly nice, as was the staff. And I think that's the first point you have to understand. If you get COVID now and you're not vaccinated, there's not a lot of sympathy for you. I'm sorry, I would still be sympathetic to you. I'm sympathetic to all the people we take care of who are sick with anything, and I've taken care of enough COVID people that occasionally I think, oh my God, you have COVID and you're sick as heck and you didn't get vaccinated. Are you an idiot? But, hey, it's okay. I'm respectful of people making their own choices, but you have to understand that the vast majority of people who are the frontline caregivers, and here's a big shout out to the ER doctors, nurses, critical care physicians in all these hospitals, they are burned out, sick to death of COVID. They're sick to death of people getting COVID who could have gotten vaccinated and not been there. They're sick of working these hours and the destruction it's doing to their emotional lives and their intellectual lives. And I'm not judging that, but I think that's totally realistic because they're just humans. And you have to understand as a patient, if you get COVID and you're not vaccinated, the sympathy factor for you is going to be low. And unless you're seeing me and a few people like me, and 2, there's no beds for you right now in Oklahoma City. There's not. You're going to get sent home unless you're critically ill. If you're just seriously ill to critically ill, you're going home. I saw this guy today, then for a follow-up. He never opened his eyes, spoke, or moved. His wife did the appointment with him. He kind of groaned once. His O2 stat saying at 90%. We're seeing him again tomorrow. The only thing I can do for him at this point is I put him on steroids and antibiotics. But, we're going to check him again and see if he meets criteria to go into the hospital tomorrow. He doesn't right now. That is the future for the unvaccinated. It's being at home, sick as hell, and potentially dying because there is no beds here, even in Oklahoma. If you're in Arkansas or Missouri or, God forbid, Florida, it's a disaster now. So I would really, really encourage you to remember vaccine saves lives. There was a Falls Creek pastor who died recently, again, who hadn't gotten vaccinated. There's just so many people who have been resistant to vaccination who are getting super sick and dying. And it's avoidable. You can lower your risk by 99%. I would strongly encourage you as an adult to get the vaccine if you're unvaccinated. You are not going to get the care we normally would want you to. It's very unlikely. And so you're going to get sicker and sicker. And even if you end up surviving, which you usually will most of the time, you're going to have long-term damage, which is hard to deal with. And I'll be honest, it's expensive to deal with too. And being disabled is no fun. And having lung disability is totally bad. Carrying around oxygen the rest of your life. So the bottom line is this. Wake up, please, if you haven't been vaccinated and you're an adult, please, please, please get the vaccine. You're running out of time. You are going to get the Delta variant. So let's segue on the Delta variant into masking. So Fauci was talking about masking today with kids and said that there could be long-term damage from it. They don't know. There's going to be long-term damage from it. We know that from the suicide rates and the nature of humanity. there was an editorial, I can't remember, in the Washington Post, I can't remember where, about this today. And the bottom line is, masking is fine. If you're someone who really believes in masks, then I would say, why do you care if someone else doesn't wear a mask? If they actually work, then you should just shut your app and be happy you're wearing a mask or your children are wearing a mask. I personally don't think with the Delta variant that masks make any difference at all. It's too infective and it replicates too fast. People don't wear their masks right. The mask data has been crappy from the beginning. We thought it was better than it was, and we know the single best thing is ultraviolet light on your face. That's, again, my opinion, but there's other opinions. I respect the other opinions. The bottom line is we're never going to know if masks work or don't work, but if you actually think they work, then you shouldn't care if they don't work, or you shouldn't care if someone else isn't wearing them because they're working on you. I don't think they do, but that's me. I've looked at the data as much as anyone can. The convolutions are too intense. Someone from the CDC or the NIH said, Dr. Fauci, that their data before shows that it worked. I never saw data from them before that showed it worked. It's an untruth. Just like many things they promote, they say there's data, but they never publish it. So, okay, enough of that. Kim, questions?
Yes.
Sorry, I'm so intense, but I'm like, people are good. If you're not vaccinated, you're just going to get screwed in this deal if you're an adult. I just want you to know that. And send this to everyone you know who's not vaccinated. I've been very conservative about this, but it's reality. You are going to get the Delta variant, and if you're taking your supplements and your vitamins, you may not do that bad. You may actually do pretty good, but you could still do bad, and if you're not doing any of it, you could do really bad.
You were saying initially, has Delta changed your mind about the MMR vaccine being preventative?
Oh, we have no idea, but we still know that when we look at the intensity of disease, because some of the MMR papers showed, one in particular, that your higher your titer, the more immunity you have. So I don't know with Delta. We don't know if that's an alteration or not. We are definitely seeing a greater number of kids cases. Overall, though, the seriousness relative to the amount is not increased, but the number of cases is increased.
How do you feel about boosters?
I'm not for boosters unless it's a high-risk person who has poor immunity and didn't respond to the initial vaccines. I think the greatest effect of the booster is going in an average person, let's say someone like me, who has an antibody titer of 400 to 500, when I checked it, is it's going to make me sick, and it's going to cause me to potentially get some negative effects from the booster, which would include viral masking, because that's what happens with repetitive vaccines. Now, if on the other hand, you're a chemotherapy patient for rheumatologic disease, cancer, ulcerative colitis, Crohn's disease, that's a different thing. You getting a booster may be a good idea. I would have you get your antibodies checked. SARS, quantitative COVID antibody, LabCorp does it. It's easily obtained. I would get that test, because if your antibodies are at a good level, you're probably fine. If you have none or scant, you would maybe be concerned because you're on an immunosuppressant. Did I answer that correctly?
Yes.
Okay. Not correctly like Kim tells me what to say, but did I actually answer the question and not ramble?
A little bit of it.
Sorry.
How do you feel about the Johnson & Johnson?
I think the Johnson & Johnson vaccine, we are seeing some data from Oklahoma, which I mentioned, that it's not as strong against the Delta. It's still a really good vaccine. In particular, I think if you're a male, I worry still a little bit about the thrombotic stuff with girls. So a single dose J&J vaccine for a male I think is pretty reasonable. Females, it's still a good choice, but there's going to be people who get blood clots from it either way. I'm not saying that you can't from the Moderna or the Pfizer, but we do know that the J&J has some association. So I usually push girls more toward the messenger RNA vaccines. When the Novavax comes out, if that data is good, that will be our go-to vaccine, but we just have to wait and see what happens.
If you've had the vaccine and get exposed, can you spread COVID?
You can spread COVID if you're symptomatic. And again, there's this theory that maybe you can spread it if you're asymptomatic. Show me the data. Show me the infection. So again, we know that if you're symptomatic, you can spread it because you have COVID then. That's the whole thing. If you're asymptomatic, you don't know if you have it, we don't know if you have it. So who knows if you can spread it? And if you don't have it, you can't spread it.
So this person got the first shot and then contracted COVID while waiting to get the second shot. In your opinion, should they get the second shot?
No, that's a journal article straight out of the science, which I've talked about. The greatest immune response is one vaccine and the infection. If you have both of those, and we look at those people and we've seen them, I mean, their antibody titers, again, are in the multiple thousand ranges, which is what the Science Journal article said. They have the greatest immunity of anyone. And there was no improvement, and this is particular, the Science Journal article defined the fact that the second vaccine did not improve their immunity.
If you get the vaccine while you're pregnant, does it benefit the baby?
So that's a great question. The answer is yes. You're going to get, especially if it's in the first trimester or early second, well, through the first 2 trimesters. Yes, if you get it at the end, maybe not so much, because it takes, classically a few weeks to develop your IgG antibodies. They have to build up and they'll cross the placenta. And then if you breastfeed, they'll cross. And yes, it's breastfeeding. It's not chest feeding. I'm an OBGYN. That's crap. It's breastfeeding. And if you don't like it, turn me off, go away. I don't care.
I don't know that people here are really.
But I'm serious. This chest feeding thing, no, it's breastfeeding, okay? Anyway, if you breastfeed,
random.
The IgG antibodies come over in the colostrum, which is going to give 6 months of protection against COVID. That is the classic data.
Okay.
For all infectious diseases that the mom has been vaccinated to or has, or has had.
What are your thoughts on Lambda?
So Lambda is interesting because they're beginning to cry about Lambda. The Lambda data that I've seen with the genomic stuff doesn't seem to be that it's that important. The gamma they're talking about, but again, I can't find any genomic data on it. The stuff I've read about the genomic data on Lambda so far was not concerning, and they didn't think it was going to be more of a variant of concern. But again, there's so much media hype, it's hard to know, and I think we're just going to have to wait. But so far, no, I'm not worried about Lambda.
Okay. And I think it was a nurse contacted, just wanting you to mention that RSV is going around.
Yes, and I think I've mentioned that already, that and I think it was Homer who commented about, where do I get these statistics from? I get statistics from reading, which I've told people, and I get statistics from other experts in our community who get data from their own public sources. So the children's data source is from someone at Children's Hospital who's a senior leader there. Sorry, it's privileged information that I can't say who it is. It's not I can tell you what the data is. I'm not going to say who sent it to me. So if we look at, and that's likewise, he's the same person because it is a boy that said the RSV is skyrocketing. RSV is skyrocketing. So that's what's so interesting. They're having tons of RSV admissions across the entire United States with relatively few, again, COVID admissions. Now, Arkansas is having more, but they have more pediatric cases. And Florida's having more because they're having more pediatric cases. So yes, if there's more COVID, there's going to be more pediatric admissions. But for the most part, the kids are doing well. There will always be exceptions. There will always be exceptions, unfortunately, and I wish there wasn't. That's about it. Take care. Good night.